welcome to Adapting Place. Thank you for deciding to join us. So let's review some NCLEX concept in nursing regarding maternity stages of labor. This is a very interesting area of maternity health promotion. Most of your questions in your NCLEX, when they come to maternity, if they're going to ask you about labor and delivery, is that portion. So let me briefly try to orient you to some key facts. You really want to know this. I suggest you know the stages of labor. There's 1, 2, 3, 4 stages. Stage 1 is the biggest. It has 3 phases. So there's phase 1, there's phase 2, and there's phase 3. Based on dilation and maternal behavior. I'm trying to simplify stages of labor. If you need more content, check out that NCLEX. And then you have to know what happened at each phase. What is the mother going to do? What kind of cervical dilation? What is going to happen in terms of the dilation and the behavior? Then know what happened to stage 2, stage 3, stage 4. If you know this, you know everything about labor and delivery. And that's what the question is. Straightforward, but you have to spend some time to understand what are the stages. And under stage 1 is the only one that has phases. That's why most of the questions come from stage 1. But you have to know stage 2, 3, 4. You have to know maternal behavior. You have to know what is the cervix doing. You have to know what action you should take. This is the way to learn labor and delivery. So, like I said, if you need information, you should try Adapting Class. So this is just a question to illustrate that, right? This is the question to illustrate that. Which stage and phase of labor is this client in? You got to figure out. And nurse is caring for a client in labor, right? The client is about 8 centimeter dilated. Contraction are strong and occur every 2 to 3 minutes. So they're getting closer and they're very strong. And the client expresses an urge to push. You can tell that since the cervix is not 10 centimeter dilated, we are in still stage 1. That is the key. I'm showing you how you can master it. So this is stage 1. Therefore, answer 4 is gone. Then you ask yourself, what stage would the mother look like that? Right? In the latent stage, they usually 3 is up to 3 centimeter dilated. In the active stage, they will be like 7 centimeter dilated. But when you get to the transition phase, 7 to like 10 centimeters, and they will have the urge to push. So just by breaking it down into pieces, you can see transition. Mother is in the transition phase. Why is she having the urge to push? It's because she finished stage 1. You see how you can figure it out? Based on that, this is 3 is the right answer. So we are in phase 1, right? No, we are in stage 1, but we are in the transition phase, which is phase 3. So this is the right answer. But I want you to learn this. Like I said, free videos online. You can watch them. You can master maternity. Health promotion is something that can really, really affect your grade if you don't master it before you go take the NCLEX. Number 2, which stage of labor is this? Same thing. I want you to understand the stages, and every time you see any question, if you watch this video multiple times, you see that labor and delivery, when it comes to what you do and the action in terms of the stages, will be easy. A nurse is caring for a laboring client who is fully dilated, right? Fully dilated and begin pushing. What stage? So this is a test-taking strategy. I just told you, like stage 1, right? It has 3 phases. And at the last phase, which is the transition zone, you almost 10 centimeters, but you have the urge to push. They won't push. It's during stage what? 2, when they have to be fully dilated. right? To the delivery, okay, of the baby. That's all. So this is the key. You don't push unless you are in stage two. You can see 10 centimeter dilated, and I'm trying to push. Active pushing. So in phase three of stage one, you have the urge to push. In stage two, you're doing active pushing. Therefore, this cannot be phase one. Stage four and stage two, stage four is already, we are not there yet. Stage three, we are not there yet. In stage two, that you begin to push and you deliver the baby, right? So this should be like something you should be comfortable with. So this answer choice is number two, stage two. Next one. I'm trying to walk you through all the key facts. Which nursing action is most appropriate during this stage of labor? You have to know the stage of labor. A nurse is caring for a client during the third stage. So, short summary, short understanding. We have what? Stage one, two, three, four. What happened to stage one? You dilating up to 10 centimeters to get yourself an 100% efface to get yourself into stage two, where you do what? 10 centimeter dilated and delivery of the baby. Stage three is the delivery of the baby to placenta. And then stage four is recovery. You see, so when he asks you the question, go back to your content, analyze it. And he said, Mommy is in stage three. And I just told you, stage three is what? The most important is what? Delivery of the placenta, right? So, what would the mother do? Encourage the client to ambulate? No, it's in stage three. Monitor fetal heart tone? Of course, yes, but we have already delivered the baby at stage three, the third stage. What do? We got to assist with the delivery of the placenta. We don't coach breathing at this time. We start coaching during the first stage and the second stage. At this stage, we passed breathing. Most people will pick number four if you don't pay attention to the buzzword in the question. It says stage three. What happened in stage three? The most important is the delivery of the placenta. So, number three is your right answer. What is the appropriate nursing intervention? A nurse is in early labor with mild contraction every 10 minutes, and she's 3 centimeter dilated. I'm giving you a clue. 3 centimeter dilated. Early. So the buzzwords here you can tell you is what? Early labor, contracting every 10 minutes, and 3 centimeter dilated. What intervention should you do? I've given you the buzzword. Put down your answer. Let me think. What do you think is the stage at which the mother is right now? Is early labor, contracting every 10 minutes, and she's 3 centimeter dilated. If you know the stage or the phase or whatever you think the mama is in, what is you need to identify that one first. Then you know what kind of actions you take for this particular stage. What do you think? What kind of stage is the mommy in right now? Based on that, early labor, contracting every 10 minutes, and she's 3 centimeter dilated. What do you think? What do you think? You can put down your answer. Let me see. What do you think? Contracting every 10 minutes. She's in early labor and she's 3 centimeter dilated. This tells you she's in stage one. What kind of phase of that stage? To be 3 centimeter dilated, she's in latent stage. What do you do in the latent state phase for the mother? What do you do in an active phase for the mother? What do you do for the transition phase. All of them, you got to know what you do for the mother. At the latent stage, what are you doing? You're not preparing for the labor. It's not, delivery is not ready yet. Encouraging pushing. She's not supposed to be pushing at the what? Latent phase. Provide comfort measures and hydration. Yeah, this is where you teach them. This is when you give them fluid. You get them ready, right? You don't do anything. There's nothing to do. You don't administer pitocin, right? So the early thing you can do is number 3. So you can see how I'm tackling these questions based on the buzzwords in the question. Which next action takes priority? What would you do? What I can't do anything until I figure out what is the information the question is asking. A laboring client is 10 centimeter dilated. That should give you a clue. It's either I'm finishing phase 1, I'm finishing stage 1, and I'm going to what? Stage 2. And begin involuntary bearing down. So she's trying to push. The fetal head is what? Class 2 station. Now I've given you station. I'm telling you there's a clue. You have to know station. When they put station in the question, the station, you use it in terms of the issue spine, right? And that is 0. If it's negative, it's above it. If it's positive, it's below. Plus 2 is way here. Baby is crowning. It's about to come out. So plus 2 station means baby is sitting right here, ready to come out. And then mommy is basically trying to push involuntary. And there is 10 centimeter dilated. This is giving you a clue that I have passed stage 1. I have not delivered the baby. So it's not stage 3 and 4, right? It's not stage 3 because I'm not delivering placenta. So it has to be stage 2. Now, what would you do? She's fully dilated. Baby is crowning. Would you tell her to stop pushing? Will you encourage her to push with contraction? Will you apply fundal pressure? Or would you check for nuchal cord? Think about that. I've given you clues. 10 centimeter dilated. What? Already pushing involuntary, and then she's plus 2 station. That means the baby is ready to come out. What you tell her is push with contraction so that it can be effective. The baby head is already there. Plus 2 means I'm way down. Therefore, let her push with contraction. So number 2 is the right answer. This is all based on the question content. Okay, there's no need to check for anything. She's in the right position. Nobody is in distress. Nobody is in anything. I'm 10 centimeter dilated. I'm already pushing down, right? Involuntary bearing down to push, right? And then the baby is way down plus 2 station. That means let her push with contraction. This is all based on content. Once again, this is adapting class. I feel like labor and delivery should not be your enemy. It should be your friend. But you need to master the stages of labor and what you do at each action, and how would you recognize what stage or what phase the mommy in based on the information. You see, I know it's actually so many questions, just one word, but he has a bunch of information. Which assessment finding should be reported immediately? And next is monitoring a client in the third stage. I want you to master how to approach question. You see, 2 short sentence. Monitoring a client third stage, and then what? Assess assessment finding you should report immediately. This is how you answer this kind of questions. Test taking strategy. Go for the buzzword. Stage 3. Ask yourself, what happened in stage 3? That's all. That's the first thing. In stage 3, I got to do what? Deliver the placenta. That is the key aspect of what? Stage 3. That means I've deliver the baby. Now I got to deliver the placenta. Then you ask yourself, what condition should be appropriate? Should I look for safe delivery of placenta? That is the content. If you've never heard this before, this is content. To be able to deliver the placenta, the uterus should be contracted and firm so that you can push, pull it out easily. If the uterus is not firm or contracted, there's going to be bleeding. What happened in stage 3? To deliver the placenta, now this is the content you have to add it. At stage 3, we got to deliver the placenta. What is going to happen? You're going to see sudden gush of dark blood. That is a trap. NCLEX will trap you with that. It's not bleeding. A placenta cannot be delivered without sudden gush of dark blood. That is an expected finding during stage 3. Second one, the placenta is going to lengthen as it comes out. As the blood gushes out, the placenta separates from the wall and the placenta lengthens. So, two, lengthening of the umbilical cord is expected finding during stage 3. A boggy uterus is bad because it will not allow the placenta to come out. Therefore, postpartum hemorrhage. That is the problem. Mommy is going to have mild cramping pain as you deliver the placenta. So, which one you should report immediately? Number 3. This, you see, I'm trying to break it down so that you can understand that. Number 8. And this is caring for a client in the transition phase, which is part of stage 1, who is hyperventilating and complaining of tingling in the fingers and the lips. What is the next best action? Administer oxygen by face mask. Instruct the client to hold their breath during contraction. Coach the client to breathe into a cupped hand. Notify the provider immediately. I want everybody to try. If you're listening to other thinkers, put down your answer. Try this and see. And I will explain it later to you. But it's very important. I want you to see what you're thinking. There's buzzword there. I can lead you, right? First is transition phase. What do you think mommy actions will be in the transition phase? 2, I told you the patient is hyperventilating, right? And is complaining about what? Tingling in the fingers and lips. Those are the buzzwords to use to answer the question. What would you do? Think about it. What would you do in this situation? Transition phase, hyperventilating, tingling in the fingers and the lips. What do you think? This is the content. In the transition zone, what do you think? The mommy is moving from what? Stage 1 to stage 2. During transition zone phase, she will be up to 10 centimeter dilated from 7 to 10, right? She's going to have the edge, not active pushing, but the edge to push, right? And now she's hyperventilating. That is an expected finding in what? In phase 3, right? Transition phase. You teach the mommy things there. So which of these do you think is appropriate at this time? The answer choice is in hyperventilating. When you hyperventilate, what is going to happen? You develop respiratory alkalosis. The presence of respiratory alkalosis is why you have CO2, getting rid of your CO2, and that's how you have tingling in your lips and your fingers, right? So this is why she's happening. You tell her, don't hyperventilate, breathe what? In the cup and like you bring it into a bag, and that will help your CO2 retention. So that's what you tell the mommy. Very, very important. It's content related. Therefore, the right answer is what? This one. Coach the client to breathe in the cup hand. Even if you don't know this is the right answer, you know phase 3, the most important thing is teach them how to breathe. Don't push. educate them. As they get to the stage two, they will learn how to push. So that's the content for that question. What is the next first action? A client is active. A client in active labor is 6 centimeter dilated, consistent with active labor. The fetal heart suddenly dropped to 90, bradycardia. The vaginal exams reveal cord prolapse. What is the next first action? How do you manage cord prolapse? Place the mommy in the side laying position. Give them oxygen. Use a glove hand to lift the presenting part of the cord, or prepare for immediate C-section. What do you think? You're seeing a patient who has cord prolapse. What are you going to do? What is the management of cord prolapse in this situation? What do you think? There's always trap when you see these questions about cord prolapse, placenta insufficiency. There's always going to trap you. Position, right? Position. They will trap you. Watch for that. The management of cord prolapse is to relieve pressure from what? The cord. How can you release pressure from the cord? Laying on the side help with distress, right? Placenta insufficiency. It does not provide good relief with cord prolapse. Even if you want to put them on their side, this is for placenta insufficiency. It can trap you all the time. Don't pick it. Cord prolapse. What will help with cord prolapse is knee to chest position, not side laying. A lot of people will pick this side laying. Don't pick it. Don't pick it. Don't pick it. It's the cord prolapse. So even if you want to pick position, cord prolapse, you have to put the mommy in the knee to chest position, not side laying. So just by that is wrong. Okay. Apply oxygen via a non-rebreather. Yeah, it's going to be fine. But use a glove hand to lift the presenting so that you take pressure from it. Then you put the mummy in the knee to chest position, place the oxygen on the mother, some fluid, and then call the provider. It's an emergency. But positioning is no side laying when it comes to cord prolapse, right? You don't prepare for immediate C-section while the cord is already prolapsed. Right. The first thing is the first action. First action is no position. If even if there's position, this is wrong. If you want to pick a position, make sure the position is the appropriate position, right? Knee to chest. So that makes this wrong. Of course, we got to remember your lion. Yeah, the same thing. Position, right? IV fluid, oxygen, notify the provider, right? But at the same time, in this question with the cord prolapse, if I want to put a mommy in position, side laying is not the right position. So I need to take pressure off, place the mommy on knee to chest position, some oxygen, and then notify the provider. Okay, so when you see a question like that, don't not always side laying is the right answer. Trust me, those are all traps. And the last one, 40 weeks is in the latent phase of labor for over 20 hours. Latent phase means the early phase and 24 hours. She's not progressing. Which assessment finding should concern you? Blood pressure, maternal blood pressure, cervical effacement, fetal position via leopard, and the signs of maternal exhaustion and infection. She's been like pushing for 20 hours. Nothing is happening. What do you think should bother you? Blood pressure? Or how much effacement she's had? What is the position of the baby? Or mommy is tired or getting infection. Prolonged labor causes infection. It can affect the baby. Mommy get tired. She can't do anything and she has to undergo C-section. So the priority action should be number 4. There's 10 questions. You see, they highlight some of the things that you would need to know. And then from the beginning, I told you the question basically addresses some of the key. The first question basically give you some idea how you can tackle it. I see cervix, that is what, 8 centimeter dilated, contraction getting closer to each other and it getting stronger, and the edge to push. If you connect all of them together, you know mommy cannot be in the latent state. First, mommy cannot be in the transition zone, or no, it cannot be in the active zone because of what is going on. She's almost 8 centimeter dilated and she feel like she got to push. She passed the active zone, and then baby is not delivered yet, so it cannot be stage 2. So every question, think about it like that. Think about it and keep on thinking about what you need to do to be able to manage the patient. So all of the question, um, you have to look at situations. So this one, maternal exhaustion. This one, we got to lift the cord up, presenting part and figure out, and then before you can do anything. So watch the photo question, the browse version of the question, and figure out what you need to do. If you need some videos, you should check adapting class. In maternity is very important, and labor and stages of labor are very important when it comes to this kind of question. If you know what the stages are, what make up the stages, what behavior mommy is going to show, and what actions you should take. When you're reviewing your note or your video, take note at that portion. Figure out what is mommy's action in phase 1 of stage 1. What is mommy going to do? If mommy is not going to do anything, I can tell you mommy is very talkative. Okay, she talk most of the time in phase 1, right? In phase 2, she's trying to breathe, right? And then stay in phase 3, the edge to push. And then stage 2, she already pushing, whether she like it or not, right? All of them, you got to know what you need to do. Thank you for watching and have a great day. You got